More than 1 million people have died from COVID-19 across the country, and at the same time, cities like Louisville have seen an increase in the amount of people killed by gun violence.
UofL Hospital surgeons have published a study comparing the two public health crises. In a story you'll see first here on WDRB News, Christy Batista talked to the surgeons who say we need to give the same effort to gun violence.
Well, they call it years of potential life lost. The doctors explain it like this. The average American lifespan is about 75 years. If someone dies at 70, for example, that person lost 5 years of potential life. And if someone dies at 25, that person lost 50 years of potential life. This study shows because more younger people are dying from gun violence, more potential life is lost. As a trauma surgeon, Dr. Keith Miller knows all too well what it's like to comfort someone who just lost a family member to gun violence. Over the past decade, there have been more than 6,000 people who have been hurt by gunfire in Louisville.
What we're talking about is an endemic problem in our community.
Meaning gun violence has been an issue here for a very long time. UofL Hospital surgeons decided to study the data and compare it to the response to the COVID-19 pandemic.
We talked about the fatigue, the misery, the mental health issues that come along with the COVID pandemic and healthcare systems and the public dealing with that on a very prolonged period of time. And I think in many trauma centers across the country, that's been true of gun violence for a very long time as well.
What they found is now published in the journal Surgery. In 2020, 10,000 years of potential life lost to gun violence in Louisville, 5,000 years of potential life lost to COVID-19.
That's not to say that any year of life is any more important than any other, or that any life is any more important than any other. The objective of this study was to say that these two public health issues have impacted our community in a substantial way.
Over the past decade, every year leading up to the pandemic, the study finds we've lost at least 5,000 years of potential life to gun violence, the same or more lost during the pandemic. Many of them are young people.
Being a surgery resident, someone in training at a younger age, we're seeing that these victims of gun violence are people around our age.
Dr. Will Reisinger is a UofL surgery resident also published in the study. Both agree that they weren't surprised by the data, but they hope others will hear it and take action to stop the gun violence.
We've seen a lot of responses to COVID, and that's significantly impacted all of us, but it's also led to better control of COVID. I try and think about where we were 2 or 3 years ago, and life was a whole lot different. And I think with that amount of resource and that amount of community involvement, hopefully we could make some sort of similar dent in gun violence that we see in the community.
We do have a link to the study on our website if you'd like to look at what exactly they found. All you have to do is head to WDRB.com. Christy Batista, WDRB News.